Thank you all for joining us here. My name is Izumi Nakano, and today's program is Lymphoma Research Foundation's Talking with Your Healthcare Team series. During the presentation, I'll focus my discussion on supporting your mental health and offering resources for ongoing support for those touched by a diagnosis of lymphoma and CLL. Before we begin the program, I'd like to share some information about the Lymphoma Research Foundation. Our mission is to realize the promise of science to eradicate lymphoma and serve those touched by this disease. We're the nation's largest nonprofit organization that focuses specifically on lymphoma and CLL. All our work is led by our Scientific Advisory Board, which is a group of 45 leading lymphoma experts from around the country. The Lymphoma Research Foundation hosts more than 50 patient education programs each year to provide members of the lymphoma community with up-to-date information about lymphoma and treatment options. We offer both in-person and online programming. The first is our virtual Ask the Doctor national series of 2-hour topic-specific, community-based programs that combine a presentation by a medical doctor with an extensive question and answer session. It is a great opportunity to have access to local lymphoma experts while listening in over the phone or online. Another is our Lymphoma Workshop, which is a regional one-day educational program that provides the latest information about lymphoma diagnosis, current treatment options, and patient support issues. These programs are either in-person or virtual. There's also the Educational Forum on Lymphoma, which is our annual 2-day program providing presentations from expert speakers, disease and treatment-specific information on clinical trials, the latest advances in lymphoma research, and networking opportunities for members of the lymphoma community. Please save the date for our 2024 Educational Forum on Lymphoma, October 26th to the 27th. We do also have free webinars, which are an hour-long interactive program led by leading lymphoma experts who discuss lymphoma, treatment options, clinical trials, and promising innovative research. Webinars can be listened to live on the telephone or via web streaming. Recordings of the program can also be accessed following the live program. In addition, Lymphoma Research Foundation also has free comprehensive disease and treatment guides and fact sheets, which can be ordered or downloaded through our website, lymphoma.org. Finally, we have an award-winning mobile app called Focus on Lymphoma. The app provides helpful disease content as well as unique tools to help you better manage your lymphoma. The app is available free of charge in Apple App Store and in Google Play. In addition to today's program, we have a variety of other programs and services available for you. One example is the Foundation's Helpline, which serves to complement our patient education programs. The helpline has master's level trained staff who provide individualized information on all types of lymphomas, as well as information on treatment options, clinical trial navigation, and connections to resources such as financial assistance. We also offer a peer support program called the Lymphoma Support Network. Through the Lymphoma Support Network, we can connect patients and care partners with others who have had or been through similar experiences for emotional support. If you have any questions, please feel free to post your questions in the comments below. We'd also like to thank our sponsors for the opportunity: AbbVie, AstraZeneca, Genentech Biogen, Kyowa Kirin, Ipsen, Genmab, and Merck. For today's programming, we will be covering supporting your mental health. Our agenda will be the following: learning about your diagnosis, organizing your life, preparing for a doctor's visit, financial support, identifying your stressors and emotions, support for your own mental health, and resources to find that support. So it's important to know that lymphoma is not just one disease. There are 2 major types of lymphoma: Hodgkin's lymphoma and non-Hodgkin's lymphoma. With those 2 categories, there are over 80 different subtypes. So the specific subtype of lymphoma does impact treatment that your physician will suggest, along with other factors such as your age, stage of disease. As I mentioned, treatment does depend on a variety of factors, and you and your physician will discuss to see what would work best in your particular type of lymphoma that you were diagnosed with, along with the risks and benefits of a particular treatment and the side effects associated. So it's important that patients and their care partners share questions and concerns that they have with their doctor so that together they can decide what would be the best option. It actually may be helpful for patients to write down their questions and provide it to the healthcare team ahead of time. What to expect. So after an initial diagnosis of lymphoma, the doctor may order other tests such as blood tests, imaging studies, heart and lung function. This process is often called a workup or staging studies. Some of these tests are needed to determine a person's disease stage, which measures how and whether the disease is more localized or spread out through the body. Other tests check how the disease has affected the person's overall health and major organ functions. Together with all these test results, provide the information needed for both the patient and the doctor to decide on the best course of treatment. After that diagnosis of lymphoma, you may have questions about the treatment regimen that was recommended. So a second opinion may be a possibility. It's not to question your current doctor's expertise, but to make sure that the suggested treatment plan is a good choice for you, as well as to evaluate alternative treatment options, including clinical trials. There are issues to consider, of course, when you're thinking about seeking a second opinion. You may want to first ask your doctor, can I hold off on being treated so that I can seek that second opinion? Your doctor may want you to begin treatment right away because your lymphoma may be aggressive and you may require treatment as soon as possible. It's also important to find out whether your insurance will cover a second opinion. The answers to these and other questions may help you decide where to seek a second opinion and if it's a good option for you. Please feel free to reach out to the Foundation's helpline for additional questions that you want to put together in order to see whether a second opinion is best for you. A clinical trial is a carefully designed research study that involves patients who volunteer to participate. The purpose of a clinical trial is to answer specific questions about new ways to prevent, diagnose, treat, and manage a disease or the side effects caused by a new or existing treatment. The investigators, the people that are responsible for planning and conducting and reporting results in the study, want to determine the safety and effectiveness of the treatment being investigated by making specific assessments before, during, and after a trial. The strict rules and procedures to make sure the clinical trials are designed and run in a way that protects the rights and safety of the people who volunteer to participate. The Foundation does offer a clinical trials information service and are happy to answer your questions through our helpline by calling 800-500-9976. One way to help cope with all the emotional aspects of a lymphoma diagnosis is by organizing your life. I want to quickly go over several steps that may be helpful. One is organizing your health records. A great way to do so is by using the Foundation's Focus on Lymphoma mobile app or our online or hard copy lymphoma care plan that you can access on our website, lymphoma.org. You may also want to look into the patient portal provided by the hospital where you can access your medical records. It's always a good idea to have copies of all your medical records and a written summary of your treatments in case of switching doctors or needs to see of another physician who is not familiar with your lymphoma history and treatments. If you aren't sure what a healthcare professional is explaining, make sure to ask them to clarify. Some of the language and terminology are not easily understood by many of us. There are no stupid questions. Your healthcare team is there to support you and provide the best care that they can. Patients going through treatment may experience various side effects and toxicities caused by their treatment. All therapies have the potential to cause side effects. Fortunately, medications and other treatment strategies can effectively prevent or lessen the severity of some of these side effects. Before beginning treatment, patients should ask their healthcare team about the most common treatment side effects and how to prevent and manage them. Once treatment has begun, patients need to tell their doctors, nurses, or physician's assistant about all the side effects they're experiencing. While each experience is different, A lymphoma diagnosis often comes with mixed emotions. You can have a hard time trying to return to your normal routine as if it was before you were diagnosed. For instance, some things you once did easily may now be challenging, or you may not have the same energy level you once did. It's also very common for patients to feel anxious about the future and find it particularly hard not knowing what will happen next. While feelings of sadness and worry are normal, this can have a negative impact on your daily life. It can manifest in different ways, such as trouble sleeping, changes in appetite, lack of interest in activities you previously enjoyed, an inability to handle daily chores. You may want to seek help from a trained counselor or a mental health professional if these symptoms last longer than 2 to 3 weeks and or it's just feels like too much to handle on your own. Mental health professionals can help you develop skills to reduce stress level and cope with anxiety and depression. They are all there to help you through, and we all need that kind of help at some point in our lives. It's also important to look at your overall health. Do you have other medical conditions you're dealing with in addition to the lymphoma? Making certain if you have more than one physician for any other conditions you're dealing with that all of them are in communication with each other or at least are aware of your lymphoma diagnosis. It may also be helpful to prepare for your doctor's visits ahead of time so you're ready for the visit. Speaking with your healthcare team regarding concerns or just asking questions you may have can be helpful. Also, as I mentioned earlier, a good first step is to write down all your questions that come to mind. Before meeting with your doctor, nurse, or physician's assistant, you may want to consider organizing your questions in a list to bring to the visit. Since time with your healthcare team may be limited, you should put the 2 or 3 most important questions at the top of their list. However, it's also important that your healthcare team reads through all of the questions because there may be some important ones that you never realized were important to know. Patients should consider having a family member or close friend to accompany them to doctor's visits to help ask questions and understand and remember answers. This person can also help by taking notes during the visit or just be a good source of support. It may also be helpful to bring a recording device or a phone or a tablet to record the discussion. The Foundation's Focus on Lymphoma mobile app enables you to record the sessions with your doctor. But it's also important to always ask for permission before recording any conversation. Ask whether your healthcare team has an online patient portal. These portals may provide secure email contact and educational materials, and they also allow patients to check benefits, meaning compensations that might be provided by the state, and coverage, what costs are covered by your insurance company, schedule non-urgent appointments, and also order prescription refills. It's important for patients to be comfortable with the doctor and the approaches they take. Patients and their physicians are partners in their treatment plan, so it's okay to ask questions. See what all of the treatment options are and work closely with your healthcare team with any concerns you may be having. And this healthcare team is comprised of more than just your doctor. This includes nurses, physician's assistants, social workers, nutritionists. Knowing your healthcare team can be very helpful in knowing ahead of time who on your team can address a particular question or concern you may be experiencing. For example, if you're having questions regarding financial issues, a social worker may be a great place to start for resources and support in finding help. For efficiency, one family member should be chosen as the family contact, and the healthcare team should know that person's identity and contact information. Most importantly, it is essential for patients and their care partners or their family contact person to have the name, addresses, office numbers, and emergency contact for information of the physicians involved in their care so that they can communicate with the oncologist or hematologist regularly or in the event of an emergency. Adding these phone numbers directly to a cell phone may be helpful so patients or their care partners have the numbers directly on hand if needed. It's important for you and your loved one to know your health insurance plan. Research the cost of care, what your insurance will cover. and what financial assistance programs may be available to you. There may be government assistance programs available to you as well. A social worker or patient navigator at the hospital may be able to assist you in finding those resources. One area many of us don't like to discuss is advanced care planning. This involves discussing and preparing for future decisions about your medical care if you become seriously ill or unable to communicate your wishes. It can be helpful to have a meaningful conversation with your loved ones of what your wishes may be. Many people also choose to put their preferences in writing by completing a legal document called an advance directive. It explains how you want medical decisions about your care to be made if you are no longer able to make those decisions yourself. Coping with financial difficulties can be very stressful, so it's important to know that reaching out to certain people at the hospital, such as their billing department, to potentially work out a payment plan early can be very helpful. There are resources available to you that can offer support in dealing with other expenses as well, such as rent, utilities, and other non-medical costs. You can always reach out to the Lymphoma Research Foundation or a social worker or a patient navigator at the hospital for help. And of identifying your stressors and emotions. It's important to identify what causes you stress and to understand that emotions are fluid. Knowing what causes you to feel stressed or overwhelmed may help you to identify and use the appropriate coping techniques to help you deal with those emotions. We all have different activities or ways that can help us cope. Some find it helpful just going for a walk, exercising, meditation, or maybe just speaking with friends or loved ones can all be a productive way in dealing with stressors in our lives. It can also be helpful to seek a professional for support and guidance. They can help you identify stressors, find the best way for dealing with these stressors, and the many emotions that we all can experience. You are never alone. Identify what you have control over. It can be very helpful to speak with a counselor who can help you cope with the many emotions and the day-to-day you and your care partner need to deal with. They can provide you with these tools for coping. Setting short-term goals and achievable goals can also be a good way to deal with tasks that may seem overwhelming at times. Ask for help. Your family and friends are there for support. And if that is not an option, then you can reach out to your healthcare team to assist you in finding those resources. The Lymphoma Research Foundation and other advocacy groups are also there to help. Self-care. So it's important that you practice self-care regularly to reset your physical and emotional well-being. Adopting routines for self-care will help you recharge your batteries and stay healthy. Talk with your healthcare team about developing a wellness plan to help you stay physically and emotionally healthy and improve your mood. Consider the following suggestions. Maintain a balanced diet, eating fruits and vegetables. Cut down on risk factors such as smoking or reducing alcohol intake. Try getting 7 hours of sleep per night or taking naps as needed. Meditation, deep breathing, and stretching can also be relaxing. Keeping a journal with thoughts and feelings may help you to let go of worries and fears. Communicate your fears and concerns about your disease by talking to your family, friends, doctors, or a counselor. It can be helpful to identify and plan activities as well. Know what you have planned for the day and decide what is doable and what can wait until tomorrow. Connect with loved ones for support and help with those day-to-day activities, and engage in mindfulness and relaxation exercises. Resources to find support. There are a variety of resources in helping you to find support. Personal support. As I mentioned, leaning on your family and friends for help. Individual counseling, so finding a therapist or a counselor that specializes in coping with a cancer diagnosis. Support groups through the cancer center that you're currently seeing, or an advocacy group. Peer support. Seek additional support of emotional and social support for people with cancer, such as the Lymphoma Research Foundation's Lymphoma Support Network that connects patients and care partners with volunteers who have experience with a similar type of lymphoma, a particular treatment you're about to begin, or similar challenges. There are also online message boards, social media, and other avenues of support. Just know that you are not alone in this journey. There are different resources of support that we are more than happy to help you find. Thank you again for joining us today. We also like to thank again our sponsors, AbbVie, AstraZeneca, Genentech Biogen, Kyowa Kirin, Ipsen, Genmab, and Merck for making this program possible. Please remember that if you have any questions, you can post them in the comments below, or you can reach out to the Lymphoma Research Foundation's helpline at 800-500-9976. And with that, I'd like to thank you all again for joining us and have a wonderful day.